Just be a second.
We can also talk about the good parts of having cancer.
Oh, yes. Oh, there's so many of them.
There are actually some.
Oh, yeah. I think we're live. I'm just not 100% sure yet. Charles, can you tell if we're live? Because I'm not. I'm just wanting to be sure.
Yes.
Oh, perfect. Okay. Well, I don't know why it's not working on Instagram, but here we go. All right, everyone, and welcome to Chef AJ and Friends. Today is the second Wednesday of the month, which means it's time for none other than Dr. Alan Goldhamer, who is the co-author of Can Fasting Save Your Life and The Pleasure Trap. He's here to help us hammer our way to health. And today, specifically, in addition to answering the questions that you have sent in advance, which we appreciate, he's going to bust some myths about my lung cancer. And by the way, thank you all so much for the outpouring of love and support. I've received not only thousands of messages on social media, but personally thousands of texts, emails, and phone calls, and I am doing my level best to get through each one of them and answer them personally. But without further ado, we have Dr. Alan Goldhamer.
Good morning, AJ.
Hey, how are you?
I'm fabulous.
Oh, good. Are you ever not fabulous?
Yeah, just not today. Today I'm fabulous.
Yeah, you're sure we're live, right, Charles? Because I'm not seeing it. I'm not seeing it, but that's okay. That doesn't.
I hope it beats the alternative.
No, I don't mean that we're not alive, but I mean that we're live on, okay, we're live on YouTube. That's the most important place. For some reason, Instagram isn't working. So, Dr. Goldhamer, as you know, I have been diagnosed with stage 3 lung cancer, and you were actually the second person I called. And I'm sorry that you're not the first, but I felt it was more important to call my stand-up comedy teacher first.
Oh, that's probably a good strategy.
Yeah. So most people have been incredibly kind, but there have been people that have been posting some, not as kind things as you can imagine. And to me, some of these are so ridiculous about why I could possibly, as a 47-year vegan, get cancer. I'd like for you to listen to them and tell me what you think these things play a role in cancer. And the first, and maybe one of the most ridiculous, is the reason I got lung cancer is they saw me on the show once and I was wearing a shirt that had acrylic fiber in it.
Mhm. Yeah, of course, we know that if acrylic fiber were the cause of lung cancer, we would certainly see a higher percentage of lung cancer in people that wear acrylic fibers, and you'd be seeing it all over the place. So I'm not so sure that there's any evidence to support that is a stress factor that would be associated with contributing to increased risk of lung cancer or any other kind of cancer for that matter.
Yeah. Well, isn't it true that if you have lungs, you can get lung cancer?
It's true that, lung cancer is a common problem, and if you live long enough, it's almost inevitable you're going to get some kind of problem. Think about it, AJ. If people die, say at 55 from a heart attack, or they end up getting run over by a truck because they're drunk or whatever, they don't live long enough to get lung cancer or other forms of cancer. In fact, it's interesting. Some people argue that smoking actually prevents people from getting lung cancer. And it's actually true. Many people that would have gotten lung cancer eventually won't because they die of a heart attack before they live long enough to get it. So we have to be really careful about cause and effect when it comes to any of these health conditions. In fact, when it comes to cancer, there's many people that will suggest that virtually everybody has cancer virtually all the time. It's just a question of whether the body's successful at fighting it off faster than it manifests. And if you live long enough, there's an increasing chance of getting cancer. So in some ways, people that are vegans that are not going to get the other problems may end up having more ultimate problems because they live long enough to develop them.
No. Thank you. So you were saying, but I'm not sure exactly the moment we went live because it's always a delay on my end, but you said something about that there are some good things about having cancer. So what are the good things?
Yeah, does it make any difference that you're frozen to me? AJ, does that
No,
affect your?
but what I can do if I'm frozen to you, does this help if I turn my camera on
Yeah,
and
now
off?
I can see. Yeah, because for a while there, it looked like, oh my gosh, I said something offensive and she
No,
can't
no, you
move.
didn't, but you were actually frozen to me for a minute. So how do you like that?
So, actually, my experience with cancer may be a little different than most people because I see a lot of patients that develop cancer. And I've had patients now that we've been treating for, 40 years. And so they start off in their 40s, but now they're in their 80s. And, again, if people live long enough, the chances that they're going to get problems eventually is inevitable. But for many of my patients, the diagnosis of cancer, although it's incredibly traumatic initially, in hindsight, they often see it as a really positive thing. So being diagnosed with cancer, on one hand, it motivates people to do everything perhaps they weren't doing in terms of prioritizing their health and happiness. They may make sure they get enough sleep. They may be more diligent about getting exercise. They may be more diligent about their diet. And they may also be more diligent about managing their stress, and particularly the energy vampires in their life, the people that do what they do best, and that's make other people as sick and miserable as they are. So by comparison, they don't have to feel so bad. So a lot of times they use that as the motivation to do what they know they should have done, but hadn't been maybe doing fully. And then when they don't die prematurely, it ends up, they end up seeing it as actually kind of a perverse positive effect because it allowed them to or forced them to do things that they might otherwise not have been willing to take on. Many people also, it changes their perception of life. They come to terms with the fact that they're going to die. And most people don't come to terms with that fully. Everybody's going to die. It is only a question of how and when. And to a large extent, how long you live is largely determined genetically and by luck. And how well you live, though, may be influenced by diet and lifestyle. And what's interesting is the people, in my experience, that have unfortunate, either the bad luck or bad circumstance to develop cancer, that live healthily, often do very well compared to people that are on conventional programs. So I don't know that cancer is never a good thing, but I don't know that the diagnosis of cancer is always necessarily a bad thing, particularly if people take advantage of it to motivate them to make the most out of the life that they have left. And in hindsight, many of them end up with a whole long period of excellent life that they might not have had they never been, diagnosed.
Thank you so much for saying that. A lot of people are telling me, well, cancer isn't necessarily a death sentence, but it is a wake-up call.
It is definitely a wake-up call.
It
And so
sure.
how you deal with that wake-up call, is really important. It's like so many things that, again, if you did not have had that diagnosis, you wouldn't be aware that there's a problem. Just like millions and millions of people out there have problems they're not yet aware of. And so becoming aware of it is a disadvantage in the sector that can be very stressful, and we have to kind of cope with the fact that we're mortal creatures. But again, if you take advantage of it, it can be very motivating. I'm confident that you're going to be able to take this circumstance and make the most of it, and let it drive you to do all the things that you want to do in the way that you want to do them. And hopefully, well, we'll get a good long-term outcome, despite the fact that you have a very serious diagnosis.
Thank you for saying that. You give me hope. And I just want to be clear that like people are saying, well, Dr. McDougall didn't believe in screening. Why did she, early? I didn't get lung cancer screening. It was found completely incidentally on something else. So I wasn't looking. Believe me, I would have rather not known and just lived
Right.
until I died.
Right.
Yeah,
So, the fact is, though, that you can take advantage of the fact that you do know for the very reasons we've just been elaborating. And you can't do anything about that now because it comes up incidentally. You know what I mean? It wasn't like you were out there looking for issues, but, once you become aware of them, you got to take advantage of them.
absolutely. Thank you. So here's another conjecture why Chef AJ got lung cancer. It's because she's hypothyroid and she took the medicine for hypothyroidism, which, by the way,
Well,
I started a few years ago. Isn't it true, Dr. Goldhamer, that if I have this 28 millimeter tumor, it's been there longer than the time that I've been on thyroid medication?
oh yeah, no question. I mean, that's got at least 10 years and perhaps longer. But also, I don't think there's any evidence that people on thyroid replacement therapy have increased incidence of lung cancer compared to people that aren't. So there's no reason that we think that this hormone replacement therapy is responsible for lung cancer. It is true that if people are on excess thyroid replacement therapy, they can have increased risk of osteoporosis and other problems. There are problems that can come from taking more than appropriate dosing. But lung cancer isn't on the list of things that seems to be associated with that particular issue.
Thank you so much. Okay. The other reason Chef AJ got lung cancer is they're saying Because I have acrylic nails. I've never had acrylic nails. This is this is regular nail polish. I mean, I don't even know what acrylic
Well,
are.
I'm not a big fan of nail polish, but there's no evidence that people that use nail polish are at increased risk of lung cancer than people that don't use nail polish. I think yeah, that's probably really stretching it. But people will make errors of attribution and all kinds of things. If you know, they love to do that about the vegan diet. That, oh, because you didn't get enough meat, that's probably why you run into problems. But they also say if their property taxes went up, it's probably because you didn't eat enough meat. So I
You
think you have to take all of that stuff with a grain of kelp.
you once said though that people like it when healthy people get sick.
Oh, they love it. They love it. Nothing better, particularly than a publicly visible proponent of healthy living gets sick, because then they can justify continuing to eat their greasy, fatty, slimy, dead, decaying flesh and not exercising and not getting enough sleep and drinking alcohol and doing all the stuff they're doing. They can justify it because, see, even if you live healthily, it's not a guarantee that you're going to live forever without a problem.
Absolutely. Okay. You're going to love this one, especially Dr. Goldhamer. You may not realize this. I just, in conjunction with Forks Over Knives, I created a pressure cooking series, and I did it right before coming live with you. And another reason I'm told I got lung cancer is because I use a pressure cooker, which, by the
Yeah,
way, I
well,
did a few years ago.
cooking food at 250 versus 212. I mean, there are theoretical detriments in terms of nutrient availability or something, but there's no evidence or reason to suggest that that kind of variable has anything to do with the development of lung cancer. And there's no increased incidence of lung cancer in people that use pressure cookers or don't use pressure cookers. I think that's really, trying to create something out of nothing. What we do know, though, is there are real risk factors for lung cancer. The most obvious is smoking or being exposed to other people smoke, particularly as a child. And so, we definitely want to not pretend that there aren't risk factors that can increase people's incidence of lung cancer. And Iran sure may not be up, but smoking can be. Other thing is living in areas where you're breathing air pollution. There are increased incidence of lung cancer in people that live in cities, that have heavy pollution versus not. But the biggest and most obvious risk factor is smoking cigarettes and being exposed to secondhand smoke.
Well, let's bring that up because one thing about me is I've been authentic and I haven't lied about anything. So I did smoke very, very briefly, junior year of high school. It was over 40 years ago, less than a half a pack a day. And the doctors have said that my smoking history is relevant and that it was not the type of lung cancer I have is not caused by smoking. But I will
Right.
say that I did live with three adult smokers until the age of 30.
Your few months of smoking probably isn't a significant risk factor at this point, but being raised by smokers probably didn't help your overall health and particularly your risk factors here, might also have been influenced. But you can't do anything about that. And at the time that you were being raised, I don't think people had the same awareness of the risk of smoking and the smoking to their kids. And in fact, at that time, physicians were often recommending people smoke to calm their nerves or to, treat other things. So, I don't know that it does any good to go back and worry about that. You also don't know who knows what exposure you've had to radon or other variables that you might not be aware of. There's environmental exposures that people get that can have profound effects. Therapeutic radiation, in terms of x-rays. There's lots of stuff that, we, in hindsight, now we would try to avoid, prevent, discourage, et cetera. But we can't do anything about what your exposure was in the past. What we can do, though, is try to make sure you're doing everything you can do today to adapt and survive and thrive. And, one of the requirements I ask my patients to do is if they can't give us a 50-year follow-up because they're too old or they're too sick, at least in the case of cancer, agree to outlive your oncologist. And so we always tell people pick a really young oncologist so that you'll end up getting a lot of years.
Oh my gosh. Well, my mother was smoking while she was pregnant with me, and I was born with
Yeah.
asthma and I have COPD.
Yeah, well, thanks, Mom. But again, Mom probably wasn't aware of what the real risk factors were. Today, most mothers are pretty aware, and so they try to not smoke while they're pregnant or drink while they're pregnant. But back then, I don't think it was uncommon for, people to treat
Yep.
smoking as just a, benign habit.
Right. Here's another reason I've been told I have a lung cancer is I use an air fryer.
Yeah, well, why would we think that that would be I guess they're thinking higher acrylamide exposure and whatnot, but I think that's going to be a pretty minimal risk factor.
Okay. I color my hair, and I just want to say that I didn't start coloring my hair until like 5 years ago, and we know
Yeah.
this has been there longer than 5 years.
Coloring your hair might have problems, but I don't think that lung cancer happens to be on the list of, primary targets for the concerns about hair coloring, although I would argue against hair coloring.
Okay. Well, thank you. I might not color it anymore. I might not even have hair anymore, so that will be a moot point, right?
See that it becomes a secondary issue then.
Oh, you make me so happy. You're just I just that I maybe you should have been the first one I called. Oh, okay. So here's one. Okay. I put carcinogenic makeup on my lips. I'm wearing some lip gloss right now that's vegan.
Because again, you're talking about things that even if they had an influence on health, are going to be relatively minor influences. I just don't think that those are on the top tier list of things that we would be concerned about. You might get skin irritation and stuff, but I wouldn't really expect that it would have a powerful immunological effect on you.
Right. Here's one that might. Up for 60 years, I lived in LA.
Yeah, I would not recommend living in LA. So, I'm glad that you've moved out of LA. That reduces that risk factor. But, although LA today isn't as bad as it was 60 years ago, when you think about air quality and pollution, air pollution in LA, despite the growth, is less than it was, at times previously. So people there today are not at the same risk factors that you probably were during your time living in Los Angeles.
Yeah. I wish I lived in not the greatest apartments, and I wish I could go back with a radon meter now and see, but I don't know if
Yeah, I
that's
don't know. Radon is not as common in this area, but there are other issues, molds and stuff that are thought to be a problem. And I don't think we all know, because the risk factor for one person may be different than risk factors for another individual. And a lot of times, honestly, it's going to be an accumulation of these various factors. Your previous exposures, I mean, if it was only cigarette smoking exposure, maybe that wouldn't do it. But the combination of this, that, and the other thing, who knows? And sometimes, AJ, it's just bad luck. I've had patients that were absolutely health conscious, diligent people that still, and particularly with lung cancer, it's particularly insidious because there's some people that get types of lung cancer have nothing to do with any of these risk factor exposures. So, like I said, how long you live is luck and genetics, and you can't do much about those two things.
yeah.
But how well you live is going to be determined by diet and lifestyle. And I think that hopefully you'll be a good example of how well somebody can live even with a nasty diagnosis just by living healthfully. And hopefully that'll turn out to be the case for you.
Do you think the fact that four first-degree relatives, grandfather, uncle, father, brother, died of cancer and
Yeah, well, again, that's a huge variable, the genetic variable, but you can't do anything about that. You can't pick different parents and different genetic stock. So what you have to do is take what you've got, good or bad, do the best you can with it. And again, my experience is people, even with nasty diagnoses that get serious about their diet and their lifestyle, tend to have much better outcomes than people that are say, oh, I've got cancer now, forget it. I can go back to being self-indulgent, short-term pleasure-seeking behavior and do all these things that doesn't build health or happiness.
yeah, thank you. So here's another speculation that why I have lung cancer. It's because I eat cooked food. I don't eat 100% raw.
Yeah, I would disagree. Actually, I'd be concerned about people that are on 100% raw diets are actually often on very high sugar, high fat diets. So I would actually not recommend that for you, but rather to do just what you're doing, an exclusively whole plant food diet that's fruits, vegetables, grains, legumes, nuts, and seeds without the animal foods, the oil, or the processed foods.
Thanks. And another person said it's because I don't eat 100% organic all the time.
Yeah, well, we certainly encourage people to eat organic food as much as possible, but I doubt that that would be a significant risk factor, particularly in terms of lung cancer. You think about all the people in the world, only a tiny little percentage eat organically grown fruits and vegetables as their dominant food. And yet lung cancer is a relatively rare condition. So the idea to equate um, these isolated risk factors as a dominant factor in contributing to a condition like lung cancer, I think is stretching it. We do know, though, that people that smoke cigarettes, for example, have a much higher incidence of lung cancer. So it's not that there aren't risk factors. individually that are significant. And it's not that all of the little different variable risk factors might cumulatively be a problem, particularly for some person. But I doubt that that's going to turn out to be a significant risk factor.
Okay, well, we have four more to go through what people have posted why I have lung cancer. It is because I worked as a chef, I inhaled fumes. But what people have to know is I had my own little kitchen for baking. There was no fumes. I was in a
Yeah.
little separate room.
Yeah, that could be a risk factor for somebody industrial exposure to various carcinogenic agents, but I don't think in your case that probably explains it.
Thank you. Here's one. I ate a lot of sugar in the past.
Well, the more sugar we eat, the more immune suppression, and that's could be an issue.
Okay, and here's I still eat a lot of desserts now, but they have dates and bananas.
Yeah, I don't think your diet right now is a risk factor. In fact, quite the opposite. The diet that you're eating is likely very protective and supportive, and probably why you're going to have a really good long-term outcome.
Okay. I had a lot of stress.
We don't know exactly how big of a variable stress has, but stress probably is not necessarily specific to lung cancer, but in general to your immune response. That may very well be a risk factor. But again, it's not a question of, you do everything you can to try to minimize and avoid stress. And I think now that we're trying to maximize your immune system, I think that it is good to try to minimize stress going forward to maximize healing. Like, for example, I don't think you should be spending a lot of time listening to all the haters, taking joy and glee in the fact that you've acknowledged having to deal with a health problem, and just kind of let all that go. I would, there's just so much stuff out there that you don't need. The good news is, as you've experienced, there's an awful lot of healthy, supportive people. I saw a lot of the comments from people that had been successful at surviving their diagnosis of lung cancer. And I think that kind of stuff is very encouraging to show that other people, have been successful and can be successful. It's not quite as much doom and gloom as people always assume. And, so put yourself in an environment of supportive, helpful people rather than, all the people that basically are going to thrive by trying to make other people more miserable than they are.
I'm glad you said that because just so the haters know, I know there's been some videos made about me. I haven't seen them. I have a team that has looked through them, and that's where we got these comments to just to have this fun interaction. So I don't pay attention to them. I just know they exist somewhere out in the ethers. But I can't say the lady's name right now, but I'm going to be doing a series of shows all of January called Thriving in the Face of Cancer. And of course, you're as a regular guest, you can come back next month and talk about the people that you have seen overcome.
Oh, well, that'll be great.
Yeah.
Yeah, because
So
it is encouraging people to realize that, people often do very well despite very bad diagnoses. And the common ground is not just diet. I think it does have to do with how people adapt to the stresses, how they deal with their response to having a diagnosis. And again, I would be hopeful that you'll have, really outstanding results so we can rub your success in everybody's face.
well, and when I'm dead, I wouldn't care anyway. So you got to
Well,
help me.
that's one way to look at it.
Listen, I don't think people know this, but we weren't ready to announce it now, but it's coming soon. But on July 7th of this year, I've produced 23 conferences with my husband, health conferences all across California. And I decided to retire from producing because it's very, very stressful, the ticket
Yeah.
sales and all that stuff. And just as one door closed, another window opened, and I had been asked to host an epic plant-based conference that's happening in Vegas Labor Day weekend. And you're one of the speakers.
Wonderful.
And so that's where and so I was just asked to host it, but the producer found out about this and said, "Hey, why don't you debut your lung cancer comedy there?" So I'm not going to do it on Zoom. It's not as effective. So anyway, maybe you can come help me write a few jokes because we
Oh, that'll be great.
actually,
I think
one
that
of
would
the,
be
I
good.
just got to say, I know you don't like mushy stuff or people getting emotional, but I appreciate you so much, Dr. Goldhamer, your friendship and your all these years. And one of the funnest times I had was driving with you in October to the San Francisco Veg Fest and testing my material on you because you are not you're a tough sell when it comes to laughing. And the fact that you were able to laugh, I know that these were good jokes.
Yeah, yeah.
Yeah. And so next month you can even bring.
It's not that I don't like to laugh. I just don't find most stuff funny. So, that's.
But you were able to find the stuff that I was saying funny and
Oh yeah,
actually
you got some good stuff there. Yeah, well, it's good content base, so that's good.
give me some good ideas. So if you guys want to know about this conference, make sure you're at chefaj.com because I mean, not only is Dr. Goldhamer speaker, but of course, Dr. Lisle, they always go together. Dr. Neil Barnard, Brenda Davis, Chris Wark, Dr. Christy Funk, 102-year-old Dr. John Scharfenberg, Tammy Kramer, Nutbeg Notebook, Lisa Maris and Nate Maris, Raw Food Romance. I know I'm going to be forgetting something. There's more. John Pierre is going to be there. Dr. Will Bolshewitz. I mean, we have an all-star lineup.
Oh, this sounds wonderful.
Yep, yep, it's going to be amazing. So, but I appreciate what you said because I can't say the person's name right now. They'll be on the show next month, but and you may not be aware of it off the top of your head. But there was a patient at the TrueNorth Health Center that is now 80 years old, a retired physician, and at the age of 70 was diagnosed with stage 4 lung cancer, and this person is thriving. And so we're going to bring
Good.
her on the show, and
Yeah,
she
that's good. I think it's encouraging for people to see that even serious diagnoses, when they're managed appropriately, can have really good outcomes. So,
Great. So another reason they're speculating Chef AJ got cancer is because she has anxiety and that suppressed her immune system.
well, I think working on anxiety and its manifestations is important for everybody. So, yes, it's good that you're reducing your exposure to the high stress activities and focusing on the activities that you find joyful and helpful. And doing, you want to have productive activity, but you don't need to be overwhelmed with excessive, stress activities.
Okay. And so I saved the worst for last, not the worst, but I don't like to get into controversy. I don't mind if other people do. And since I've been transparent, I haven't really hid anything from anybody. But so this is a lot of people said that the reason I got lung cancer is because I got the jab, meaning the COVID vaccine. Now, I will tell the audience whether I got it or not, but Dr. Goldhamer, even if I got it in 2020, I couldn't have a 28 millimeter tumor 2 years later.
Well, yeah, no, but I would say though that there is an instance in people that have a history of autoimmune disease and cancer. Sometimes repeated exposure to the vaccine seems to be an activating factor, and so I don't know that we know how powerful an effect this can have immunologically, and I don't know that there's any particular correlation to lung cancer. But like you're pointing out, your lung cancer development was probably predating any of these particular exposures, but it could be an aggravating factor. In fact, all of these things to some degree can be an aggravating factors. It's just a question of trying to get, proportionality to it. And most of these things that we've talked about are, at best probably incidental potential relationships. It's not the major relationship, for example, that smoking might be. But I wouldn't underestimate the fact that exposure to some of the newer vaccines, we don't know yet how powerful a negative effect that it can have. It certainly does have some negative effect, at least for some people.
Right. And I'm not saying that it's good or bad. I'm just saying that to believe that that's the reason I could be stage 3, I think is a little bit of a stretch. And just so people know, I did not get the vaccine, not because I have any big philosophical, I'm pro-choice if people want them. I didn't get them because I had an exemption because of my lifelong allergies and having had
Yeah.
allergic reactions to both the flu shot and the pneumonia shot when I
Yeah.
was in my 40s. I was
No, then it's very unlikely that that could have been a triggering factor for you since you didn't even have it. But that
exactly.
won't keep people from saying maybe it's because you were thinking about getting it that you got the problem. You considered it, and that was,
Yeah.
that was enough.
Yeah, when I was in my 40s, I worked as an activity director at a retirement home, and but I didn't know as much now as I did then. And we were forced to get a flu shot and a pneumonia shot, and I had severe allergic reactions to both. And since then,
Hmm.
I'm just lucky. I'm on an exemption list. I don't have to get anything like that. So anyway, it's enough about me. Let's make it about you, Dr. Goldhammer. We have so many questions, many that were sent in, and many that are in the chat. So, okay. Oh, so here's a question. Why have I chosen not to have treatment? I have not chosen not to have treatment. If you watch the last episode, which I'll link below, you cannot have treatment without a tissue biopsy, even with the alternative doctors and the holistic ones. And I haven't had my biopsy yet. So watch that show. My biopsy is next Tuesday, and I'll know the results on the 26th of December. And I'll be back on December 27th with Dr. Matt Letterman, and will reveal the results. And so I have not, it's not like I've done it, nothing. I've been to TrueNorth twice for two weeks each
Right.
time. I've done 2 water fasts, and I'm optimizing my immune system in other ways by increasing exercise and doing all the mental stuff that's supposed to. So I haven't chosen not to have treatment. So Anyway, that's that. All right. So let's get into the questions that were submitted. The first one is from Beatrice. Dr. Goldhamer, I'm a 35-year-old woman with a history of excruciatingly painful periods since I began menstruating at the age of 12. I recently did a 5-day at-home water fast during my period to see if it could help alleviate my cramps. I experienced absolutely no pain throughout the fast. The following month, I was surprised that my painful cramps had returned. Clearly, something I'm eating is directly contributing to my painful periods. I eat a low-fat plant-based diet with soy, very little salt, oil, and no added refined sugar. Do you have any idea what the cause could be? Is it healthy to fast during the menstrual cycle every month? And why do people always assume it's something they're eating?
Mhm. So let's just talk about what we know about dysmenorrhea. There's a number of conditions that affect women, and dysmenorrhea, menorrhagia, fibrocystic breast disease, PCOS, uterine fibroid tumors. All of these assorted conditions are thought to have relationships to uh, estrogen and estradiol. And estradiol is an active form of estrogen that normally gets broken down to, I think, something called estriol, which is excreted in the urine. And the process of breaking that estradiol down to estriol is dependent on the gut microbiome, the organisms that live in your gut, as well as your liver function. And so when there's alterations in gut microbiome or alterations in liver function, sometimes people don't process their hormones. And it's probably not just that. It's probably much more complicated than that. But the idea being that hormone balance gets disrupted and people grow fibroid tumors. They get PCOS, they get fibrocystic breast disease, they get dysmenorrhea. Those symptoms and those problems often reverse with fasting and a whole plant food diet. And we are postulating, the research isn't done yet, but we're postulating that the reason why these problems consistently improve in women is because the hormone processing, like estradiol to estriol conversions, improves as a consequence of resolving the gut dysbiosis and the liver dysfunction. And we know those change because we've got evidence that liver function improves and the inflammatory markers, the non-specific liver dysfunction markers, the SGOT, GGT, et cetera, normalize after fasting. So we're thinking that the reason may be a normalization of hormone balance because of changes in gut microbiome and liver function. That's why that whole class of symptoms improve. In my experience, the changes that you see in dysmenorrhea, though, aren't necessarily the first month after the cycle, but the second. The hormone cycle is already set up when you're actively fasting. And so you wouldn't necessarily see the change until the second cycle. And so a lot of that'll depend on dietary compliance and lifestyle compliance between the end of fast and then the normalization of menstrual function. But we do see that improving consistently. However, there are problems, including endometriosis, that don't always, it's not like 100%, resolution. So I don't know specifically in this patient's case why she's not getting sustained relief, but I would be persistent in continuing to do the diet and lifestyle changes and continue to do periodic fasting as appropriate so that this condition can resolve. And usually they do resolve. She didn't mention if she's at optimum weight or not. You know,
I've seen this person and I believe she's quite slender.
Yeah, so that's unfortunate. I wish she was dramatically overweight because the extra fat, the extra visceral fat contribute to the inflammation, then we could lose the weight and expect to be even more optimistic. I always am annoyed when you see patients that are eating well and living well and doing everything right that have problems. Those are much more difficult patients than the people that have, 50 things that they need to improve in their diet and lifestyle. But that's why we have places like TrueNorth Health. So, we do it may be that 5 days of fasting isn't a long enough cycle to, resolve the issue. Let's do some additional fasting and see if it'll help.
Great, thanks. While you were answering the question about whether or not the COVID vaccine, which I never got, created my lung cancer, Skippy, who's watching live, said, well, could having COVID be a factor in cancer? I did have COVID twice.
Well, who knows? It's pretty early. We know that, millions and millions and millions and millions and millions of people have had COVID, and most recover. About 10% have residual long COVID symptoms that often, interestingly enough, tend to respond to fasting and dietary change. But I don't know if we know yet. I have no particular reason to believe that that would be the case, but it's possible.
Great. Florence, who's watching live, said, "What are your thoughts on red light therapy or infrared red sauna?" The reason I mention that is another one of your thriver stories, which I'm not going to say his name, but he's 14 years after cancer. He's somebody that went to True North. He says that I should get an infrared sauna.
Well, sauna and all of these natural therapies have some benefits in the sense they increase blood flow to various parts of the body. Increasing blood flow, particularly in people that are eating well, thought to be, helpful. I haven't seen any particular evidence that people that use infrared sauna recover better or do better than people that don't. But, I guess it's possible. I certainly wouldn't have any particular problem with people using saunas.
Okay, thank you. All right, let's see what else we got. Somebody's asking, this is a question for me, but I'd like you to weigh in because you can answer it. Should I be doing something different? So MB is saying, am I doing anything different now that I've been diagnosed with lung cancer, like excluding certain foods or other lifestyle modifications? So I'll answer it first, and then you answer it what you would tell me to do. Of course, I pretty much do everything you tell me. So one of the things I'm doing is I'm going to True North as often as I can. I've not been great at fasting longer than 3 days on water and 3 days of broth. I've been seeing Dr. Peter Sultana, the medical doctor there, every single month virtually and keeping tabs. He's keeping tabs on my situation. So I'm not. I mean, I don't know if I can keep just throwing more kale at it. You know what I mean? Because I mean, my diet before the diagnosis was, if Dr.
Yeah,
Goldhamer was an A plus, I was probably an A
yeah,
or an A minus.
yeah,
I will say, and we've talked about this, Dr. Goldhamer, because I got down to 100 pounds, and so I am eating more calorically dense food now. I am
yeah.
eating some gluten-free bread, and when I say that, it's not every day, once or twice a week. I've added avocado liberally, and I'm even eating nuts now. I mean, it's like I feel bad, but I can eat as much as I want
Well,
now.
I think including the richer foods like avocado and nuts is probably a good thing because we do want to keep adequate caloric density. In fact, we'd like to build you up so that we can do more fasting. One of the disadvantages of being on a really healthy diet is you tend to be healthy and lean and all that. You don't have the extra reserves that you would on a conventional diet. So I think that you're doing the right thing. I don't think dietary manipulation is going to be a substantial source of additional improvement. I think you were already at doing well, and I think what you're doing now is appropriate to your situation. Um, I think the biggest thing you did that you changed was you reduced some of your stress. You were doing live presentations every day, and even though you love it and it's a good thing, it's too much, every day. So cutting back to doing things more moderately, where you're doing the occasional show and the occasional thing. I think that's a better strategy to prioritize sleep, to make sure there's time to exercise, that you have minimize your exposure to the haters and maximize your exposure to the people that are helpful. That's probably going to do more uh, than worrying about what the fiber in your clothes is.
Yeah. Well, thank you for saying that. And I did do a live show every day for 4 years and 3 months and didn't take a day off. But I kind of want to go back to doing that, Dr. Goldhammer, because I have so much now to say about this, and I really want to help people, thrive in the face of cancer because I feel like. There's a quote by Joseph Campbell of like, you have to be willing to give up the life you had to live the life that you were supposed to live. And I feel like kind of that's my purpose now. But I will say that
Well, and nobody says you can't do that, AJ. It's just a question of quantity versus quality. I think as long as limit your activities to the level that'll be consistent with optimum health, that's fine. But you tend to be an all or nothing
yeah.
and go a little bit too crazy. So I think you have to regulate the
Yep.
quantity. And the way you can tell though is if you're getting enough sleep, if you're having enough time to eat well and exercise, if you're having time to spend enough time to spend with the people you love. And then there's some extra time, fine. You can dedicate that to helping everybody else and doing all the good work you try to do. But I think you have to prioritize your own health and happiness right now and not sacrifice it because you're trying to do all the right thing. And I know you can't help it because you're a kind, loving person. And Dr. Lyle's explained to me you can't help that because that's genetic. But you just got to kind of limit helping everybody else and try to at least reserve enough energy for yourself that you have a good outcome and prove that we're right and everybody else is wrong.
Well, I'm going to tell you what I'm doing because I was going to reveal it with Matt, but it's like really amazing. But what I wanted to say is that what I'm doing is I'm working on like a lot of the mental, emotional kind of, stress, anxiety stuff, which is true. And the thing that I'm doing is I have this thing I call it the seven foundations to health. And so for me, what I'm prioritizing is faith, family, fitness, food, forgiveness, friends, and fun. And so that's like
Well, that sounds
that's
pretty good.
yeah, because before I was just living in fear and like prioritizing finances because I worried I was going to have enough money. Now, like my day, I start with faith, and like the most important to me is faith and family. And I do prioritize fitness because when I was diagnosed, there was a very small group of people like you and Dr. Lisle, and of course Dr. McDougall, who was helping me that knew because I was seeking help, and Dr. Terry Shintani was one of them, and he sent me this research that how like exercise is important anyway, but when you have cancer, it is critical. And so I do exercise like a maniac now, in the morning. So I have to prioritize that. And of course, the food, working a big deal on forgiveness. I'm in Chris Wark's program, but really friends and fun are like the most important thing to me now. So yes, I will work when I love it, but friends and fun. And I consider you a friend, and I consider you like literally the funnest person I've ever met. So thanks.
Well, I've never been accused of that before, but that's
Oh, I think you're hilarious. So Simone says, Dr. Goldhamer, can you explain why fasting hasn't had an effect on AJ yet? It has. It didn't disappear my lung cancer. You may not know this, Dr. Goldhamer, but two wonderful things happened as a result of both the fasts. After the first fast, my thyroid medicine was practically cut in half, so I'm still on it. I didn't go there for that, and I may never get off it, but the dose was cut in half.
yeah,
And also, I didn't go there for my IBS, but since I water fasted, I don't have bloating or
right.
any types of IBS
Yeah.
anymore. And I wasn't even going to that for that.
Right. Well, and the thing is, fasting is just an extension of healthy eating. It gives the body a chance to do stuff. It's not going to necessarily make everything in the world disappear. We don't expect that. We don't necessarily promote that. And the other thing is because your weight's limited, it limits your how long you can fast. You can't fast when you don't have reserves, and so the impact is going to have to be dragged out over a longer period of time, multiple shorter fasts rather than some short-term longer fasts that might have had a more dramatic short-term effect. And we also don't know, because there's not any real research done, the effect that fasting particularly has on lung cancer per se. We're worrying about fasting affecting your overall health, not necessarily the specific condition or diagnosis. And we don't know that fasting is a particularly directed treatment for lung cancer.
It's interesting though, because there's a very active chat, and I'm sorry I can't like look at all of it, but people are saying, why are people saying that? Do you have ever noticed though that when anybody gets sick, especially a vegan, like it's always blaming them first, like make they did something, you must have done
Well,
something.
you understand why that is, though, AJ. If you, a person who's very public and has been very compliant with a healthy eating, can develop a problem, right? That means they're vulnerable to a problem. And they're not being as diligent as you are. And so, what they want to believe is that if you just control your diet, or if you just control your stress, or if you just do the exercise, that you're immune from any problem. And we're not. We are aging creatures that are going to get sick and die at some point. Now, what we hope is that our demise is associated with going to sleep one night and not waking up. You have a good life, you have a good death, you reach your genetic potential, hopefully later rather than sooner. And that's what the hope of healthful living is. Not that you're going to live forever, because you're not. It's that you can live well. You want to avoid the years of debility that most people suffer with. Those last 16 years where people find themselves unable to talk or move, lying in a nursing home bed, waiting for people to come and change their diaper. We want to, not pretend, though, that whatever you do prevents you from inevitably aging out and dying. What we're hoping is to be able to make that last 20 years of life the best 20 years. And I think actually, in some ways, you have a better chance of having that happen now than you might have before, because you even have to face with the very, very real reality that your time is limited. And so I think the sooner everybody realizes our time is limited, the kinder we're going to be and the healthier we're likely to choose to live. This fantasy that we all live forever needs to go, because it's just delusional.
Yeah. Well, it's interesting because, you and I, it's so funny. I mean, that was just such a wonderful trip to the San Francisco Veg Fest because as we were driving, Dr. Matt Letterman called you. So I was there listening on speaker.
Yeah.
And you both were instrumental about my, in quotes, coming out because I had wanted to do it right away because I mean, I just that's who I am. And everybody's like, no, no, it's going to hurt the vegan movement. And, people are going to tell you what to do. And I think for the most part, it's been a wonderful experience because not only have I received an outpouring of love and support, and by the way, please don't send me any money. If things get bad, and my nephew, whose name is Jory Goodman Jr., he has a wonderful YouTube channel, Time Teller. If he starts a GoFundMe, and I've told him not to, that would be legitimate. And while I appreciate it, I don't have any expenses right now. But if I get treatment and I do, I'll let you know. And I don't, what I'm trying to say is a lot of people responded with what I should do. And the thing is if I did everything everybody said, I don't have enough lifetimes to literally do
Right.
everything.
But you have excellent advice from Dr. Letterman. You have, and Dr. Sultana. You have excellent people that can coach and consult you, and you're a smart person, so you're going to make good decisions. So it is nice though to see people that are so supportive. I thought it was very encouraging to see all of the people that wrote in about their own experience and what they had done that had been helpful to themselves. And I thought that was very kind of them. But it's also interesting to see, as I said, how many haters there are that can't think of anything they'd rather be able to comment on than somebody else's demise. But those people, you have to just move on. You don't need that.
Well, I'm curious. I'm going to ask your opinion about this because I feel like we're friends and I would have asked you anyway, but why not ask you on the air? So, I'll get the staging on the 26th, and hopefully, this is the only thing I'm worried about is like if they don't get enough tissue, because then there's no, we can't do that. And Dr. Letterman will be able to read it and tell people what that means. But once I know, I've been honest about everything, but should I be honest whether or not I get treatment? Because whatever
Of
I do,
course,
here's the thing, Dr. Goldhamer, whatever I do, somebody's going to be mad and pissed off.
of course. But
If I
I
get
think you should be honest because you are the kind of person that likes to be honest, and you're going to find it stressful not to be honest. And that's what we talked about earlier about going public or not. There's huge disadvantages to going public, but there's also advantages. And the problem is the disadvantage for you not to go public would be that you would feel that you're not being honest. And so you're one of those people that has to be honest in order to feel good. And so that's why ultimately I think you had to go public, is so that you wouldn't have the stress of feeling bad. Other people that they don't have those burdens of ethics and all that stuff. You do. I mean, look at your drive into veganism. Unlike what I might advocate for personal health, but you're doing it to save the planet, to save the animals, because you're one of those kind of people. And again, I don't hold that moral, ethical, and spiritual driven personality against you because as Dr. Lisle explained to me, it's genetic. You can't help that. That's who you are. So I think you're going to have to be honest about whatever you're doing only for your own benefit. Now, it also probably helps the kind, loving people out there that genuinely will, learn and benefit from your experience and sharing it. And the fact that it's going to piss off the haters, they're going to find something to be upset about anyway, AJ. If it's not you, it's going to be something else. So I don't think you have to feel bad that you're aggravating the haters. I think you just have to let them go.
What one thing, and I've always been very honest about this, just not everybody knows me, like from the dog whisperer when I had panic disorder and didn't leave my house for a year because they probably haven't read my books. But a lot of time my decisions are based not on the best medical advice, but that anxiety is driving the bus. And I wish I could do what Dr. McDougall told me, which is just do nothing and stay away from doctors and never get another CAT scan. Because one of the things I talked to him, oh my God, anybody that says anything bad about Dr. McDougall, if you knew what he did for me, Dr. Goldhamer, he'd come to my appointments with me. I mean, not in
Yeah, I
person,
know.
they Zoom. He was my, do you remember the television show Batman, Dr. Goldhamer?
Yeah.
So you know how there was the bat phone that Commissioner Gordon could like get Batman. That I could call him at any time. He would Zoom with. I mean, I cannot tell you. I mean, we became so close until he died because he was my lifeline. So it was doubly devastating when he died. But 2 days before he died, he was in good health. I saw him on Zoom, and people were speculating all this stuff about him that's nonsense and making videos. But he really said, "I think that you will die." With your cancer, not from it. And
Right.
I keep his
So,
voice in my head.
the thing that people I think misunderstand what his argument was. He wasn't arguing that lung cancer is not a serious problem in Israel. He's just saying that the conventional treatments that are available haven't really been shown to be impacting all-cause mortality. So his argument was, why would you do a lot of invasive, aggressive treatments, unless in your particular case, there's good reason to believe it's going to help improve the quality or the quantity of your life. Any patient that has cancer should always be asking their oncologist, okay, is there evidence that in my particular case, this particular treatment has been shown to help me either live longer or better? Like, for example, there are many treatments for cancer that they might do a surgical debulking, not because you're going to live longer. You're not going to live longer because they debulk the tumor, but it prevents it from putting pressure on the nerves or causing problems or difficulty. I have a patient I talked to just recently who has a cancer that was expanding and putting pressure on the aorta. Well, if you don't deal with that mechanical problem, you're going to die. Well, you can deal with that problem and still do all the things to try to get healthy to prevent cancer from progressing and stuff. But sometimes surgery or other medical treatments are going to be necessary because they're going to improve the quality or quantity of your life. They're going to get you out of pain. They're going to help you deal with the problem, not necessarily live longer. And the point is, most of the treatments associated with lung cancer haven't been shown to help people live longer. So then the next question is this treatment going to help me live better? Is it going to improve the, and if it is, well, it might be justified in doing conventional treatment or alternative treatment, whatever it is. The problem is in lung cancer, there's not like a lot of compelling evidence that any treatment, alternative or conventional, has a profound effect on its progression or its outcome. And as a consequence, McDougall would argue, unless there's some compelling reason to take the risks of associated treatment, you'd want to not do those treatments. You need to have good reason to, you don't just intervene for the sake of intervening. And you have additional complications in that you've got sensitivity to anesthesia. And so most of these things that have to be done require to be under anesthesia. So you have to weigh, oh, is the risk of anesthesia for me enough to offset the benefit of, say, getting a biopsy and learning? And so it's complicated. People don't understand. It's not always just a simple, oh, we just go in and take a sample. That itself can be a risk. And then the question is, if I get the sample, assuming it's the worst, whatever diagnosis I can think of, is it going to change how I treat it? Is there treatment available that might help me live better or longer? And so, those are decisions that really have to be done, not so much on the internet, but with your doctor. And that's why it's fortunate you have some thoughtful doctors that aren't idiots and they can help you evaluate the risk and reward. And it's not always obvious, AJ. Sometimes, there's some benefit, there's some risk. You have to make a decision what you're comfortable with. And some people are more comfortable intervening aggressively. Other people are more comfortable being more conservative. You have to know your personality and then make a decision that you think is in your best interest. And it might be good or it might be bad.
Yeah. One thing though, Dr. McDougall did say that if you decided to get conventional treatment, that I would understand and he wouldn't, he'd still be my friend. It's hard. It's a hard decision. Why are you laughing about that?
Well, I don't think that the idea that, oh, if you do something different than what somebody thinks now, they're not going to like you or be your friend. I just
Well, I don't know.
find that.
My brother's a medical doctor and he's yelling at me that I haven't done something sooner. And, the hard thing is, and one of the things I've been doing now, and it takes about 3 hours a day I spend in support groups with people with cancer
Right.
and with lung cancer. And that's where I've been getting a lot of support. And what I'm hearing, because I know more people with cancer now than I ever have in my life, is that none of them had symptoms until they got treatment. So in other words, that if somebody has a symptom from cancer, that means it's already really advanced. So because I have the hard thing about me thinking about treatment, whether it's chemo, radiation, or surgery, I don't have any symptoms. And so to be cutting and radiating and, medicating when I feel great, except for my anxiety, seems a little weird to me. But
Right. And the problem is that treatment, even accepting conventional, thinking about it, can compromise short-term life for theoretical long-term benefit. And if there's good evidence that people that cut and burn and do all this live longer, that would be compelling. You could make the case, yeah, you'll suffer, but you'll end up living longer. But when the evidence doesn't suggest that people are necessarily going to live longer, then you have to weigh, is giving up feeling good now in exchange for known secondary side effects worth the potential benefit? But that's something you and your doctor have to kind of discuss, and ultimately you have to decide, which to, because it's not a black and white, oh yeah, if you just do this, then everything's fine. That's not how it works when it comes to cancer, particularly cancer that's metastasized. So, you know, people have to be supportive and sympathetic that it's not an easy decision, and you're not making a knee-jerk, emotional reaction. You're trying to do it intelligently by looking at all the facts and the support and getting different input.
I'll be judged either way, so I may as well just, go with
Oh,
my.
absolutely. No
Did you ever,
question.
did you ever see the Michael Caine movie? I think it was in the 70s, Juggernaut, where like it came down to him cutting the red wire or the green wire, and if he cut the wrong, that's what it feels like being faced with this decision. And that's why for 2 years I've been paralyzed with fear because I didn't know what to do. But I
Well, it was
still.
also complicated, though, in your particular case, because the decision to do a more detailed diagnostic involved anesthesia. And so that was another complicating risk factor and motivating. And it also should be noted that for 2 years, there wasn't significant change. So it's only recently that you've been noticing change, on your diagnostic. So that's a significant consideration too. Because so even though now in hindsight, now you're saying, okay, well, there is progression. It's pretty clear the diagnosis is likely accurate, even short of an excisional biopsy. For 2 years, it didn't seem so, obvious because normally, this doubling every 100 days or whatever, that wasn't occurring. So, you have to take that into consideration too. There's a lot of things to think about when you're deciding what to do or what not to do. It's not a simple situation. And I think that's one of the potential benefits of going through this process in public is that people get a chance to get a feel of how difficult it is and how many different options and things there are to consider.
Yeah, it's very easy for people to say, if I were you, I would do this when they're not me.
Yeah, until they're you in that circumstance, you find out it looks very different.
Yeah. Well, it's not all about me. So let's ask Jericho's question. Dr. Goldhamer, I was wondering if I've had terrible dandruff my whole life. It never lets up. I recently started using a prescription shampoo called ketoconazole that temporarily relieves the itching, but it always comes back with a vengeance. Would juice fasting or water fasting help? And would visceral fat contribute to dandruff and skin issues in general? I've tried eliminating gluten, but that didn't resolve the problem.
Okay, so there are, the yeast situation on the skin can result in dandruff. There are topical applications, people use various types of shampoos and things to try to change the environment on the scalp, but you also have to change the internal environment. Um, Juice fasting on high fruit juices, I don't know that would be a very good idea because really high sugar diets tend to aggravate these conditions. If you're doing water fasting, oftentimes we do get improvement. And then a diet that's dominated by vegetable materials oftentimes seems to be helpful for many people. As far as the specific exogenous agents, there are a number of different approaches to changing the environment of the skin to kind of reduce the eczema. But again, they tend to be more temporary unless the internal changes are made. And yes, if you're carrying extra fat, you have extra visceral fat, there's more inflammation, that's going to be a contributing factor to this and pretty much everything else that people suffer from. So what I would do is, um, you might want to work with one of the doctors on our telemedicine practice, and that could help you kind of fine tune the dietary issues, consider the possibility of doing a longer term fast to break the cycle. And hopefully we can come up with a combination of exogenous agents and internal changes so that you can resolve the problem.
Great, thank you. Next question is from Julianne. Dr. Goldhammer, is there any benefit in grounding, walking barefoot on the ground, or using a grounding mat?
Well, I hear a lot about that. It's very interesting. I haven't seen any really compelling research yet, but I think if you're walking, that in itself is going to be useful. And if you're walking barefoot on the grass, that's probably soothing and relaxing, and there probably is some benefit to be had. But whether or not the basic theory about, electrical grounding activity is real or not, I'm kind of a skeptic of everything, including the stuff I do advocate, and I'm certainly a skeptic about the magnitude of the benefit, but I don't see any harm as long as if you're walking on the ground, make sure you don't cut your foot or something.
Great, thanks. And we have one more previously submitted question. Best way is to write help@chefaj.com and then submit them that way. Susan says, can you ask Dr. Goldhammer why a person's A1C continues to improve, but now the triglycerides are high? Is it too much fat from
Yes.
tofu, nuts, and seeds?
Well, too much fat in the diet can be a factor, but also too much sugar. So sometimes what happens is people shift into a diet that's dominated by fruit, and particularly fruit juice or dried fruits. and that will drive the triglycerides up. So you want to make sure your diet's dominated by vegetables. And if you're having problems, maybe limit your fruit to whole fruit, berries, melons, things of that nature. And really emphasize the raw and cooked vegetable materials and see if that doesn't help bring down the triglycerides. The fact that the blood sugar levels are coming down as represented by the A1C is good, but maybe not. Maybe there's a little bit more fine tuning that needs to be done. And also, don't forget that exercise and sleep can also have influences there on blood lipid levels. So make sure you are getting your exercise as well.
Great. She mentioned she doesn't think labs are reliable. Are labs reliable?
Yeah, labs are fairly reliable, and we test it by sending in split samples and other things, and I think you can get fairly consistent results. That the fact are errors made, absolutely, and so you wouldn't take any individual measurement overwhelmingly. It's always good to repeat questionable tests. Take everything with a grain of salt.
Great. Thank you. Okay. Somebody's asking if I'm eating G-bombs daily. I can't eat beans. I'm allergic and I hate
Well,
mushrooms.
don't eat beans then.
Yeah, I mean, I'll eat mushrooms if I can find a way I like them. I just don't, but I do eat greens every day. I do eat berries every
Wait a
day.
second. What do you mean? Would you find a way you like? Do you take shiitake mushrooms and you steam those or bake? You don't like those?
I like the mushrooms you have at True North. Can you tell me how you make
Well,
them?
those are yes, those are just button mushrooms, but they're baked. So they're just baked plain on a sheet, and that changes their texture, and that's a really good way to do mushrooms. So you do like mushrooms, you just have to prepare them properly.
Okay. Thank you. Maybe Bravo will give me the exact recipe. I think we have time for one more question. Marissa,
Exact recipe. Let you put them on the baking sheet and turn the oven on, and you wait until they're done. That it's not, what's the recipe?
you are gonna, this is like Norman Cousins. I mean, if we could just talk every day, I'm gonna be healed. Thank you. Marissa says, I have uterine fibroids. I know you've had some success with those. She says, enlarged uterus, other than feeling pressure in my upper torso, I'm asymptomatic. I'm postmenopausal. I do eat very little meat, but no dairy. I need to go all in. Will fasting work?
Yeah, likely fasting and diet and lifestyle change will work. You want to get to optimum weight, eliminate visceral fat, do a long-term fast, get the, if it's appropriate, get the exercise and the diet right, a whole plant food SOS free diet. And then it's likely that you will, especially the symptoms that are associated with the uterine fibroids, the menorrhagia, the dysmenorrhea, those things oftentimes improve uh, relatively quickly and consistently. Sometimes the masses themselves reduce, sometimes the masses don't reduce, but the symptomatic effect does. So either way, you're likely to win.
Great. Dr. Goldhamer, thank you so much. This was so much fun.
Oh, excellent.
Well, we'll see you next month. And please feel free to share some slides because I know you have some very compelling research on
Oh,
the
I've got some good slides for next week. We can show we've got individual case reports, but also some case series now that we've had published. And it's very encouraging indeed.
Great. I can't wait. And thanks all of you for watching another episode of Chef AJ and Friends. Please come back at 9 a.m. Pacific time on Saturday with Dr. Dan Nadeau. He's going to be talking about how you can improve your metabolism and reverse diabetes with fruits and vegetables. Thanks, Dr. Goldhammer.